The World Health Organization says the number of people globally who have died with COVID-19 in the last week has jumped by more than 40%. However, the number of cases has fallen. There are around 10 million new COVID infections in the last 7 days and more than 45,000 deaths reported. Numerous countries have now lifted most of their restrictions, choosing instead to rely on vaccinations, and some countries have changed the way they count fatalities.
In the best case scenario, we may see less severe variants emerge and boosters or new formulations of vaccines won't be necessary. In the worst case scenario, a more virulent and highly transmissible variant emerges. Against this new threat, people's protection against severe disease and deaths, either from prior vaccination or infection, will wane rapidly.
China has shut down Shanghai as the city recorded almost 6,000 coronavirus cases on Tuesday. It follows Asia recording more than 100 million new infections. And with me now is Dr. Bharat Pankhania. He is a senior clinical lecturer at the University of Exeter's Medical School in the UK. Welcome. Thank you so much for being with us. COVID cases, as we just said, in Asia surpassing 1 million, Shanghai expanding its lockdown. Now, at the beginning of this pandemic, we often looked to Asia when we were in Europe to have a kind of a modelling, an idea of what could be coming our way. Should we still be doing that? And if so, how concerned should we be?
I think we've now got a divergence. And the divergence is that the United States, Europe are highly immunized compared to China, which has also started its immunization program, but the vaccine that the Chinese are using is not as effective as the ones that have been used in Western Europe and Northern America. So I think we're going to see a divergence. Also, China has adopted a zero COVID policy, but only China can do things like what China does. So I do not think that it is possible for us in the West to follow the Chinese example or for them to follow our example.
On that point about the zero case approach, which China is pursuing, as you say, does that mean then that COVID is endemic?
I very much think so. And we've got a global spread of the infection, and also our vaccines are only good so far in that it doesn't create permanent sterile immunity. And therefore, we've got to come to terms with, yes, we're going to have some variant, some versions of a variant always in circulation for the foreseeable future.
Talking about vaccines then here in Europe and the idea that we may not be able to approach that permanent sterile immunity and that we're going to keep having these vaccinations. EU leaders at the moment in Brussels are talking about coordinating their approach to giving people the fourth dose of the vaccine. Do we know how effective the fourth dose is faced with these mutations that we've been seeing?
So far, so good. And the vaccines that were created have held forth, even with the variants such as Delta and Omicron. There could come a moment when a variant emerges which completely bypasses the vaccines. So far, so good. With respect to the boosters, well, there is clear evidence. There's clear evidence that it boosts the level of antibodies, and that level of antibodies boosted protects the especially vulnerable people. This is the older age group and people who've got other underlying conditions. So boosters is one way forward, but the other way, and equally important, is to immunize the rest of the world. We cannot carry on boosting forever. What we need to do is suppress infections elsewhere. And when we suppress infections there, we will also forego the need for constant boosters here in the northwest European countries.
Just sort of one final question. When we think about these mutations, is it fair to say that we could be faced in the future with a mutation that actually is more harmful?
Indeed, it is entirely possible. So the pathway isn't always that the mutations are always in the less innocuous way. We hope, but it could equally go in the other direction, whereby it, as I said, bypasses vaccine and causes more severe disease. Therefore, another reason why we must suppress infections globally. That is one tool to reduce the potential for a variant to arise.
All right, Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter's Medical School in the UK. So great to get your insights. Thank you.
Thank you.